dysfunctional breathing in athletes. And I suppose the question that you would need to ask is, how do you assess dysfunctional breathing? And in one paper that was published it was a study actually in Japan of 1,933 athletes. And as far as I know, it was published in 2022. They looked at athletes of different ages, from youngsters in schools right up to professional athletes. And they found that in around 90% of them, give or take, had dysfunctional breathing from a biomechanical point of view. Now, they used the high-low test. So the high-low test is typically the person can be sitting or standing or lying. And they have their one hand on chest, one hand in around the area of the diaphragm. And an examiner is looking at whether this person is breathing high in the upper chest or breathing low with good recruitment of the diaphragm. Now, it was found that 90% of these athletes had dysfunctional breathing. Now, what does that mean? Well, when it comes to an athlete, if you have dysfunctional breathing, you're more likely to experience premature breathlessness. So you're more likely to gas out too soon, especially with upper chest breathing, because upper chest breathing is very, very inefficient. You know, if we really want to have adequate gas exchange taking place, we're much better breathing slow and low. Another aspect of dysfunctional breathing from a biomechanical point of view is that the diaphragm breathing muscle, it plays a very, very important role in terms of providing stabilization of the spine. And there's a relationship between breathing and movement. If breathing is dysfunctional, movement is dysfunctional. And when movement is dysfunctional, the athlete is at a greater risk of injury. Another aspect in terms of dysfunctional breathing can be muscle fatigue. And in terms of, there's other aspects of it as well, but say just staying with the biomechanical dimension, because as I said, when you do look at dysfunctional breathing, try and hone in what exactly are the examiners looking at here. Are they looking at breathing from a biochemical dimension, a biomechanical dimension, or a psychophysiological dimension? So this study in Japanese athletes was biomechanical dimension, and very, very high proportion of them having dysfunctional breathing. And yeah, that's going to affect their athletic ability. So, you know, when we think about training, we should also be thinking about training the breath.